Let's have a quick prayer here. Our most kind and loving Heavenly Father, we ask you to send your Son here, because he said anywhere there's two or three gathered, he's there in their midst. And we want your Son to be here, and the angels, and please give me the words to say that I might be able to help even one soul today towards the kingdom. And may you help me to say the right words so that the message will go so people can understand what I'm trying to tell them. And we ask this, that if there's anyone here that needs to give their life to your Son, let them do it today and not put it off till tomorrow. In Jesus' name, amen. I guess I'll reintroduce myself here. I'm a medical doctor. My name's Glenn Waite. I graduated from medical school in Morelos University in Mexico. This was the first class of surgeons, physicians and surgeons in Morelos, which is a Seventh-day Adventist university medical school. And then I served several years of residency training, and currently I'm board certified in family medicine and also in physical medicine rehabilitation with subspecialty in spinal cord injury medicine. And I also have a Master's of Public Health from Loma Linda University. But compared to the greatest physician that ever walked the earth, which is the Son of God, I don't know hardly nothing. I'm still learning. And I'm trying to claim that my home is in heaven, and I'm trying to claim that match, and that he went to prepare for me. Right. And you can do the same. He has many matches, he says, and there's room enough for anyone that wants to go. Amen. Amen. And I want to. This lecture is going to be an educational exercise. I'm not here to to diagnose any person's disease or to prescribe them any medications, but it's an educational exercise. And I don't have. And usually, when you do a lecture like this, you say, "Do you have any things to say if you're connected with any pharmaceutical company or any other entity?" I don't have any connections at all. My connection is with Jesus Christ, and the Father who sent him. Yes. That's my connections. So first of all, I want to talk about one thing. As I had lectures on the phone last year for this camp meeting, and one of the important things is that COVID-19 virus is transmitted through the air. It's more airborne than it is droplet. And you can think about it, though it does not smell, you can't smell it like natural gas or cigarette smoke, but it still is transmitted by airborne. And Jesus Christ was ahead. You know, when he had his Beatitudes, ministry and stuff, or he fed the 5,000, they were out on the grass and out in the open air where there was plenty of ventilation. And that's one thing we need to remember. This COVID, if it's airborne, and if you're close in sight and you don't have ventilation, that's a building that you should walk out of and not stay there, because something that doesn't have any ventilation is a public health problem. Anyway, this series is the days of Noah, and Jesus said before his second coming, it would be just like the days of Noah. And Genesis 6:5 says the intents of their thoughts were only evil continually. And I think you don't have to look very far to see that that's happening today. And there's this philosopher, Sergei, I probably don't know how to pronounce his name, Nikovsev or something like that, a 19th century Russian revolutionary. And a lot of the persons in this world now today the thinking has gone to, well, it's all right to lie a little, it's all right to cheat a little, it's all right to go in the store and rob a little, as long as you're doing it for the common good or for somebody's good. But what does Ecclesiastes 12, 13, and 14 say? Let's hear the conclusion of the whole matter. Fear God and keep his commandments, for this is the whole duty of man. For God shall bring every work into judgment, whether it be good or whether it be evil. And so we got to think about that every day. Jesus said we would be condemned by our words, or our words would lift us up. But there's other things that we need to. Also, the important thing, what comes out of our mouth, first starts thoughts in the brain, and if we have the right thoughts, and also if the wrong thoughts come in, we need to get rid of them quickly. And not let them dwell in the mind. And so this is what Patriarchs and Prophets says in regard to what happening in the days of Noah. The holy inhabitants of the other worlds were watching with the deepest interest in the events taking place on the earth. In the condition of the world that existed before the flood, they saw illustrated the results of the administration which Satan, or Lucifer, had endeavored to establish in heaven in rejecting the authority of Christ and casting aside the law of God. In those high-handed sinners of the antediluvian world, they saw the subjects over whom Satan held sway. Oh, Patriarchs and Prophets, page 78.
Thank you so much.
Okay, and then the reference goes on. Every emotion, every impulse, and imagination was at war with the divine principles of purity and peace and love. It was an example of the awful depravity resulting from Satan's policy to remove God's creatures the restraint of his holy law. By the facts unfolded in the progress of the great controversy, God will demonstrate the principles of his rules of government, which have been falsified by Satan and by all whom he has deceived. Patriarchs and Prophets, 78 page. His justice will finally be acknowledged by the whole world. Though the acknowledgement will be made too late to save the rebellious, God carries with him the sympathy and approval of the whole universe as step by step his great plan advances to its complete fulfillment. He will carry it with him in the final eradication of rebellion. It will be seen that all who have forsaken the divine precepts have placed themselves on the side of Satan in warfare against Christ. Patriarchs and Prophets, page 79. When the prince of this world shall be judged, and all who have united with him shall share his fate, the whole universe as witnesses to the sentence will declare, just and true are thy ways, thou King of saints. Revelation 15:3, Patriarchs and Prophets, page 79. So what is the answer to the COVID-19 pandemic for God's people? He says, if you diligently heed the voice of the Lord your God and do what is right in his sight, give ear to his commandments, and keep all his statutes, I will put none of the diseases on you which I have brought on the Egyptians, for I am the Lord who heals you. That's a promise we can claim today. We don't need to fear COVID-19 pandemic. What we need to fear is Satan, who works through other people to take away the mansion that Jesus is preparing for us in the heavenly courts. I want to give some quotes from Dr. Robert Malone. He is the inventor of the mRNA technology. You probably heard of the Pfizer and the Moderna vaccines. He has a lot to say about vaccines and also what's going on today. And he has expressed some statements that he's not comfortable the way things are going today. He says, this is a quote from him, the government owes to the populace, that's the public, to be open and transparent as to what is true and as to what is known and what is unknown. Now, the way the mRNA technology works is they take a spike protein, and this is a little projections out of the virus of the COVID-19, and they take one of those that are protein, and they encapsulate it in some lipid of where it can go through the cell wall and program the transcription of RNA to make other proteins. Many people take biology and they would understand this, or they'd have to review the textbook under biology. Of course, if they also studied physiology, it may be in that textbook also. But he states the spike protein can be cytotoxic, and it circulates in the blood as free and bound, and it crosses the blood-brain barrier. He states the vaccines were rushed to the FDA experimental approval, and the studies in rodents were not done to high standards. This is his statements. Everyone involved in producing the vaccine wanted to save the world, and to say that corners were not cut is not true. The CDC and other individuals try to say this is safe, corners were not cut, but he's saying something different. Now you'll see at the bottom where it says trialsitenews.com. Whenever I quote these things, I need to put down at the bottom the source of where I got it from. And also, if you read many people's books, including The Great Controversy and Ellen White's books, if she got a quote from another book, she will give the reference or where it came from. And so that's what that means at the bottom. He poses that that there are some questions that need to be answered before it went to FDA experimental approval, and according to him, these questions were not totally answered before it got FDA experimental approval, these vaccines. Where is the spike protein expressed after injection? Where is the RNA going after injection? Now, they were able to do that a little better because they tagged it to some radionuclide and they could see what organs it went to. And where is the lipid part after injection? Where does it go? So, people are probably acquainted with this Gaussian curve normal distribution, and you may not if you haven't taken statistics. But I also worked in occupational medicine, and you know there's plants that people are exposed to different types of chemicals, and they have to disclose on safety data sheets as to what chemicals are out there. But then how do they determine what is a safe level in the work site? Well, they go by this normal distribution, and they usually say if two standard deviations, which is 95% of the public, and there's 2.5 on each side. If it doesn't affect 95%, then that level of the chemical in that environment is okay. But then, if you're in something that's in the 2.5% at the end, and it affects you, that's 100% to you affected. And the same thing with these side effects from the vaccines, and also side effects from drugs, is they say, well, we've done studies and it only affected, there's 95% that didn't have significant enough adverse effects, so that means that it's safe. But then the problem does with any drug that I've seen in my lifetime as a physician at 42 years. So they'll come out and say a drug is safe, and 4 or 5 years later, after millions of people have taken it, they send a telegram to the doctor and says, we're pulling it off the market because it's no longer safe. So as it goes on, there's more and more people reporting adverse effects. But for the COVID-19 vaccines, it's not mandatory that anybody reports anything for adverse effects. The doctors don't even have to report it. I mean, we have to report things like syphilis, or things like gonorrhea or chlamydia, or other diseases. But we don't have to report this to anyone. And then also too, if you get a vaccine is a drug. A drug by law has to be prescribed by a licensed professional, either a physician, nurse practitioner, or a physician assistant. It can't even be prescribed by a pharmacist. The pharmacist has to have a doctor behind that to prescribe it. And when any time a doctor prescribes a drug, the person can demand informed consent. And you don't probably know what that means, but they need to be told, if I take this, how's it going to affect me? What good is it going to do me, and what harm is it going to do me? And this needs to be disclosed. And many times when a person goes there, they're saying, "Go get your shot. Go get your shot." But they don't disclose who prescribed that shot for you, and you never meet him face to face, the doctor. And how can you get informed consent? And how can you know what you're getting or what you're not getting? And so I think it's important that this goes not only for the vaccines, but any drug that you're being prescribed, to your satisfaction, you need to find out how is it going to affect you. What are the benefits of it, and what are the adverse effects of it in your terms, so you can understand them. And this is important because there's also mistakes that have been made, of course, giving you the drug, a different drug than what was prescribed. But still, even if you get the drug that's prescribed, it's important to know, how is this going to affect you? And I just wanted to let you know this. I think at a certain period of time, there'll be question and answers that we do later. Is that right?
Yeah, but we can take, if you'd like to have a few questions tonight.
If they want 5 minutes, I think I have 5 minutes
You can
more.
have 5 more or 10 more if you need it.
Okay, yeah, if there's any questions for anybody for the audience, but I don't know that we have a microphone.
No, you'll just have to repeat their questions so that people online can.
Okay,
ask questions.
because I've been on the other end, and I've been on the phone, and I've been on the internet, and sometimes people will talk, and it's hard to say. What did they say? And I couldn't understand exactly the question, and then I got the answer, but then I couldn't put them together.
Well, if anyone has a question, you just repeat the question.
So is there any questions anyone has? Oh, go ahead.
On one of the slides earlier, you said that there was a distribution of both free and bound. I was trying to understand how they could be both.
Okay. The cell takes in the transcription, it produces the protein, and then the protein is released into the bloodstream to transport to other organs or other places. Whether it's a protein or a drug or a hormone, they're all free and bound, and usually bound to either albumin or prealbumin or a lipoprotein. Sometimes they're bound to a lipoprotein so they can be transported in the bloodstream. like your lipids, cholesterol and stuff like that, or lipoproteins rather than free, because they have to ride on another vehicle in order to get where they're going.
Right.
Now, if the free, when the spike protein is free in the bloodstream and you've produced antibodies to that, the antibodies are going to attach to that free portion, and so the depending on how many antibodies you have, the free portion is going to be lower than the bound portion. Is that, do I need to repeat the question so everybody can understand?
Would have been a good idea, yes.
The question was the free,
How could they be both free and bound?
how can they both be free and bound? And that's just the way things are always with any chemical substance in the blood. Most of them are free and bound.
I heard someone ask earlier, what are lipids?
They're fats.
Okay.
Lipid, fats, yeah, same thing. He asked, what are lipids? Lipids are fats. There's a question in the back.
Are you saying the substances are free and bound at the same time?
She says, are these substances bound and free at the same time? Yes, they are free and bound. There's a free portion and a bound portion. And also, when you measure stuff by laboratory, you can measure free and bound. When you ask for an assay of a certain drug or hormone or other substance in the bloodstream. There's another question at the back.
So if they mandate that you have to take the vaccine, then you could say, well, I need a doctor to prescribe that to me. You can't come to my door and give it to me. And that would be perfectly legal, correct?
Yes, it depends on the state.
Repeat the question.
Oh, okay, the question was if they come to the door and mandate the vaccine, and you're asking if do you have to take it?
I'm asking,
is
how
that-
can they do that?
Oh,
if
how
the
can
doctor
they
has
do
to
that?
prescribe it, and there's no doctor there, and your doctor didn't prescribe it, so how can they mandate it? That's totally going against the law, if somebody comes to your door and tries to talk you into it.
Okay, if someone, your question is, if someone comes to your door to ask you to take the vaccine, and they say it's mandated, how can you take it when it's you don't know who prescribed it? Is that correct? You have a right to ask them who prescribed it. You have a right.
And doesn't it have to be your doctor?
It has to be a doctor that prescribes it according to state law.
Shouldn't you be able to meet this person if they're?
You have that right. You have that right.
That is an awesome question, but I have not heard of anybody anywhere having a prescription for this vaccine. Have you? I mean, you're a doctor.
Yes, I have heard of,
I don't
yes.
spend time in doctor's offices.
No,
Granted that.
Okay, the question was, he's saying, where is this where you have to have a prescription? Is that right?
Yeah.
That is the law. The states make the laws concerning physicians and the physicians' practices and the practices also of nurse practitioners and physician assistants. These are the only ones that can prescribe.
This
Otherwise, they're practicing law without, or practicing medicine without a license.
I don't argue with you on that, but this week in my state, in Georgia,
Okay?
they're coming to the schools. They sent home a form one day. The parents sign the form. They come back the next day, and they're vaccinating children in school.
Okay, the question is, he's from Georgia, and they are coming home with a form. The child is coming home with a form to have the parents sign so they can get the vaccine. You still have the right to ask who is prescribing this.
But what I'm saying is, somewhere, there's a mythical doctor that's signing off on thousands of children the same day that he never saw. There is no prescription.
Here, here.
It's a fantasy prescription.
He's saying that there's a mythical doctor someplace that's signing for everyone to, or for the ones that, in his case, that is signing for that patient or subject to or client to get the vaccine, and that how can he overcome this? Is that correct?
Well, I mean, I'm just raising the question. They're doing this everywhere en masse. They have setups in parking lots. There's no doctor there. There may be a nurse practitioner or something like that. But the person comes up and asks for a vaccination.
Mm-hmm.
That's all there is to it. You
Well,
sign a piece of paper and
So
they
the
give you a
government
shot.
has become the doctor.
Right.
Yes. He's
Yes,
saying they're
they
coming
are
with a form,
circumventing
and they're
you.
saying that they're mandating them to get it the vaccine, and that there's no doctor there or something that they know about that prescribed it. And this is, and they say that the government is the doctor. Well, that's what they're trying to do, but a person needs to know their rights
Amen.
according to the state law that they're in. Now, I don't know the state law for Georgia because I'm not there, but I know now I do know the law in Colorado. The law in Colorado is anybody can refuse a vaccine from religious or other reasons or personal reasons. Now, the law there does state that they may want you to give you some material to study from the state, but still you can take the material, read it, and still you can refuse. That doesn't mean that you don't have the right. The law says that you have the right to refuse it. But also it says in the statute that they can mandate that you were given information in regard to their ideas of way things should be. I have a question back here.
So any child who's given a shot at school and has not had a physical exam by the doctor who prescribed it, that's totally illegal then. The child should have been examined by a doctor before the shot's prescribed. Is that correct?
So she's asking any they can give the vaccine without them seeing a doctor and having a doctor prescribe it. They can if you let them do that. But a person needs to say, I want to consult with my doctor, and you can actually say, my personal doctor, I need to consult with him before you say yes or no.
Great,
That's what you need to do.
yeah.
And by state law, they have to let you, now it may take a while to get in with your doctor, but that's the best one to tell you whether this is what the informed consent is in regard to the taking the vaccine. So we might have to cut this off.
Probably will need to cut it off, but also we're having a problem with the broadcast, of people on the phone aren't hearing, so we need to restart our.
Oh, I'm sorry.
So this would be a good place to have a word of prayer, and we'll take
Okay.
like a 2-minute break, and then we'll go to the next presentation.
Okay, good.
So if you'd like to
Okay.
have a closing prayer for us, Doctor, I appreciate it.
Dear Father in heaven, we thank you so much for sending your Son to be here with us, because you know he said where 2 or 3 together, he's there in the midst. And we ask you to be with us in the remainder of the service, that we might be able to know what to do in this time of crisis, and to put our faith in you and your only begotten Son, because that's the only safe avenue. In Jesus' name, amen.